So, what is Medicare anyway, and how does it work? What does it cover? What does it cost? And is Medicare actually considered insurance? Though these may seem like simple questions, the answers, of course, are more complex. However, you've come to the right place for Medicare information. Today, I want to define Medicare and explain how it's different from Medicaid. And we'll also give you a brief explanation of the four parts of Medicare. Now, stay tuned to find out how you can sign up for our free 6-day Medicare email mini course, which comes with our new to Medicare checklist and a bonus worksheet to help you calculate your potential costs for Medicare. First, let's define Medicare's coverage. Medicare is a national United States health insurance program for people age 65 and older, or people with specific disabilities, illnesses, and conditions. The Medicare program's coverage is divided into various parts, and it's important to learn how these parts fit together. Part A is your hospital insurance, which assists you with inpatient care and skilled nursing costs. It also helps with things like hospital unlimited home health care services in and after the hospital. And in general, you should think of the inpatient hospital benefit as Medicare coverage for room and board. It covers the cost of a semi-private room and doctors and nurses that come around to give you care. Part A, for most people at age 65, typically costs nothing. And this is because you've paid taxes toward it during your working years. If you don't automatically qualify for premium-free coverage, you can pay for Part A, although it will cost you a pretty penny. Medicare Part B is your outpatient medical coverage, and it covers everything medically necessary outside of inpatient hospital and skilled nursing facility care. Without Part B, you would be uninsured for doctor visits, lab work, and diagnostic testing. You would not have Medicare coverage for preventive services, outpatient surgeries, ambulance, emergency care, many other things. More importantly, Part B covers really expensive things like cancer therapy and kidney dialysis. These things would cost you a fortune without supplemental coverage. The cost of Part B is set by Social Security, and it changes from year to year. Individuals in higher income brackets will pay more than the standard premium that most people pay for Medicare. Your modified adjusted household gross income that you report to the IRS will determine how much you pay. You can read more about the cost of Part B on our Medicare cost page on the Boomer Benefits website. Moving on to Part C, we define Part C as a Medicare Advantage program or private insurance that provides the same services as Parts A and B and also usually includes Part D. Advantage plan costs will vary by carrier, county of residence, and the plan that you select. So to enroll in a Part C plan, you must first be enrolled in Parts A and B, and even if you find a Part C plan with a zero premium, you will still pay for Part B. You must also live in the plan's service area. Once you enroll, your Medicare coverage will come from the Medicare Advantage plan and not from the federal government. You don't enroll in Part C at the Social Security office because Part C is optional. Some beneficiaries prefer to get their Medicare coverage from Original Medicare and a traditional Medigap plan. These people may not want a Part C Advantage plan, so they don't enroll in one. It's your choice whether you wish to opt for one instead of just staying with your original Medicare Part A and B and adding on a Medigap plan. Check out our video here on YouTube about the pros and cons of Medicare Advantage plans, and this will really help you with understanding the difference. Finally, Part B is the newest part of our National Health Insurance Program. Did you know there was no Medicare coverage for outpatient prescription medicines for half a century? But in 2006, our federal government rolled out Part D. Part D covers outpatient retail drugs that you pick up at the pharmacy or have delivered through mail order. You will choose an insurance carrier and enroll in their Part D drug plan. Now, most states have about 20 to 30 different drug plans for you to choose from. So the best way to determine which one is right for you is, of course, to have your Boomer Benefits agent run a detailed Part D analysis for you. Or you can do it yourself by using Medicare's prescription drug finder tool, and you can find that at medicare.gov. Now, what's the difference between Medicare and Medicaid? This is a super common question that we get around here at Boomer Benefits. By definition, Medicare is a health insurance program for people age 65 and older or people with certain disabilities. Medicaid, on the other hand, is a financial healthcare assistance plan for low-income individuals. Some people who have very low incomes may qualify for both Medicare and Medicaid. And when they do have both, Medicare is primary and Medicaid is secondary. Medicaid will help to pay for some of the expenses not covered by Medicare, such as deductibles, copays, and coinsurance. Now, depending on your level of Medicaid coverage, you can also qualify for assistance with your Part B premiums. Do you need some help with understanding what Medicare is and how it works? If so, call my team and our agents will walk you through all of this step by step. And don't forget to sign up for our 6-day Medicare email mini course to get our free new to Medicare checklist with a bonus worksheet to help you determine your estimated cost for Medicare. Be sure to view our video on how to sign up for Medicare next, and you can watch that here.